This video is the third in a series on liver cancer. Liver is an organ that sits in the right side below the rib cage. It can get damaged by alcohol, viruses and fatty liver disease, causing it to become fibrotic, which predisposes it to developing liver cancer. So how do we diagnose liver cancer? Typically, patients do not have any symptoms, and by the time any symptoms arise, the liver cancer has progressed. Symptoms may include heaviness, loss of weight and appetite, and early satiety. There may be symptoms due to the cancer secreting certain chemicals, causing low glucose, high calcium, high red blood cells, and so on. And finally, there may be symptoms due to the spread of the cancer to other parts of the body. But as I said, typically early on, there are no symptoms. Are there any blood tests that are of help? There is a so-called tumor marker called alpha-fetoprotein that, when elevated, may indicate liver cancer. It is also useful in determining the effectiveness of treatment provided. For most patients, however, the most important diagnostic tool is scans, and ultrasound is a good efficient way of diagnosing liver cancer, and increasingly contrast material when used alongside ultrasonography improves the diagnostic yield. The more important scans are the CT scan, an example of which is shown over here. This is the outline of the liver, and you can see this spherical abnormality within the liver, which is the hepatocellular cancer. One of the most important scans in diagnosing liver cancer is the MRI scan, and a system has now been developed called Liver Reporting and Data System, LIRADS for short, and suspected liver cancer is graded between 1 and 5, where 5 is the highest grade, and this typically means that patients have liver cancer, which is beyond doubt. If a patient is diagnosed with LIRADS 5, then a liver biopsy is not required for diagnosis. In some instances, however, a liver biopsy is a useful tool in confirming beyond doubt whether or not liver cancer exists. Looking at this cartoon again, say there is a liver cancer over here, then a liver biopsy is performed either under ultrasound or CT guidance, where a needle is placed straight through the skin and through the liver tissue within the suspected cancer, and then withdrawn, taking a sample with it. Since this is invasive, there's a small risk of complications such as bleeding. The point of all of this exercise is to assess the patient and confirm the diagnosis of liver cancer, confirm the size and the number of the liver deposit, and whether or not there is spread outside of the liver, and what does the background liver look like, and what have been the complications of liver disease, and finally, if there is anything else of note on the scans. This information would determine the suitability of the patient for various treatment options, which will be discussed in the next video. Thank you, and if you have any comments, please do share.